My name is James Royle. I'm a general and colorectal surgeon working as a consultant in the northeast of England for the past 9 years. I believe the comments that I will make today are true to the best of my knowledge and belief. They are my own personal clinical observations and are not representative of my employer or the NHS. From around March 2021, I started noticing new patterns of disease suddenly frequently appearing that I'd never seen before in my patients. The first pattern was blood clotting, particularly venous thromboses. One of my secretaries asked me, why are all our patients coming back with clots? I was encouraged someone else had noticed. CT scans were coming back, reporting multiple pulmonary thromboses bilaterally, both lungs, clots in the pulmonary arterial vasculature. These were not pulmonary emboli, as thromboses seen in the lung vessels are often called, because they did not usually result from embolization of a DVT, a clot in the leg, in these cases. They were occurring frequently as incidental findings on routine follow-up CT scans in my colorectal cancer follow-up patients. A new triad of spontaneous, unprovoked abdominal venous clots that I had not ever seen before, affecting the same three main vessels in multiple patients. Portal vein, from the gut to the liver, superior mesenteric vein, draining the small intestine, and the splenic vein. These patients, typically middle-aged, ranged 31 to 77 years, presented with a vague abdominal pain and no underlying pathology to cause the thromboses, no classical risk factors, e.g. absence of severe pancreatitis or advanced cancer, suddenly happening in multiple patients admitted under general surgery. Sudden increased incidence of ischemic bowel cases, usually uncommon. Many had no visible clots in their mesenteric arterial vessels on CT, as would normally be expected. This could possibly be due to microclotting in multiple small vessels or capillaries, or perhaps from thrombotic endocarditis, as Dr. Dean Patterson has suggested. These thrombotic cases had started testing for the VITS, vaccine-induced thrombotic thrombocytopenic syndrome, that had been defined in some patients after the AstraZeneca vaccine. However, I was seeing these cases after the mRNA, Pfizer and Moderna shots as well.